Dr. Eric Haas, colon and rectal surgeon with HCA Houston Healthcare. Doctor, welcome to the show. Thank you so much for your time. And of course, we don't want to alarm anyone. We're just trying to educate folks. The story is changing day by day. We typically hear about these respiratory symptoms, but now it seems to be indicating that some people are also experiencing what, cramping and diarrhea as well? Why is that?
Yes, thanks for having me, and good afternoon to you. So it's interesting, why would we be talking to a colorectal surgeon about symptoms of this coronavirus? And what we're noticing in about a fifth of patients, their first presenting symptoms are GI related, whether it be typically loose stools or having kind of like irritable bowel type symptoms. And the interesting thing is these are such common symptoms, having some stomach cramps or, a nervous type of stomach and some loose bowel movements. We don't want to alarm everyone, because just by being, situations like this where there's increased stress, you can have some belly symptoms, and we don't want you to think you're in any major trouble if it's pretty simple.
Okay, so let's talk about some of these symptoms, and because I know typically at a colon and rectal practice, you see everything, right? Hemorrhoids, colorectal cancer, ulcerative colitis, Crohn's disease, diverticulitis. If someone out there is experiencing these symptoms, is there anything that they should be doing to take extra steps to protect themselves? Or is there cause for concern that those symptoms may be an indication of something else?
Yes, I think that what we want to do is kind of listen to our bodies. And what's interesting is that people are very alarmed, and we understand that, about going to the doctor's office or the hospital or the emergency room. And everybody's engaging in safe practices and social distancing. But we do want to make sure that during this pandemic that's happening, that there's still healthcare providers here for you. And so if you're having particularly GI symptoms in the kind of stomach pains or loose bowel movements, bleeding, rectal bleeding, things like that, go ahead and talk to your doctor. Most doctors are doing what's called telemedicine and telehealth visits. In fact, I think pretty much everyone I know is. So it's as simple as calling the office and maybe making what you call a virtual appointment. So the first thing is I wouldn't get alarmed, but I definitely would talk to your healthcare provider about your symptoms and just make sure that there's nothing more worrisome happening.
And what extra steps can patients take to protect themselves if they are suffering from some of these conditions?
Well, first and foremost, if you're finding that you're having some of the GI symptoms, what the studies, and there were studies out of China, and now we're having some in the United States, what they're saying is that, number one, just engage in safe practices, washing your hands, wearing a mask if you're outside, because you might be one of those asymptomatic carriers, meaning that you might have the COVID-19 virus and you're perfectly feeling great, doing well, but you might pass it on to someone else. So one of the things that you can do is kind of help foster good care by washing your hands. In fact, the most common way that we think people are getting the virus is by hands to the mouth. And I think in Houston and in Texas in general, we're seeing a phenomenal job at keeping everything safe. But the GI kind of stomach issues are so common that I think just eating healthy, like we typically do, try to avoid either constipation or diarrhea by taking a lot of fiber in your diet, drinking lots of fluids, and eating fruits and vegetables, and pretty much staying healthy is advised.
And you just said it, GI issues are very common. If people are experiencing some things that normally they wouldn't experience, I know our schedules for many of us have changed, our diets may have shifted a bit. Are there symptoms, though, Dr. Haas, that we should be keeping an eye on that would lead us to either, call our doctor or, in more extreme cases, visit the emergency room?
Yes, I would say that's a great question, because although there's a lot of distractions right now, please take care of what your body is telling you. And some of what we call the warning signs of, some of the things that we deal with, which is a little more serious, is colon cancer. And in fact, colon cancer is still the #2 cause of cancer death in the United States. But the good news is that if you catch it early, it's one of the most curable situations. And in the colorectal community, we're noticing that we don't want something like COVID-19 or the crisis that's happening take away from your everyday care. So if you're feeling stomach pains, change in your bowel movements, weight loss or loss of appetite, if you're having bleeding, especially a little bit of bleeding from your bottom, we definitely advise for you to come in or call. We want to make sure we can screen you for colon cancer, which is something that we want to keep in mind. We don't want to forget about just the day-to-day things that we do to keep ourselves safe and healthy.
Well, Dr. Eric Haas, thank you so much for your time today. And of course, I know that at HCA Healthcare, it is so critical that care is not delayed. So the message from HCA Houston Healthcare is, do not delay your care if you do need to see a doctor. We appreciate your time today. And as always, if you would like more information, you can visit hcahoustonhealthcare.com. We'll be right back.